What if the real reason your skin is aging faster, wrinkles showing up sooner, firmness fading, and collagen breaking down has very little to do with your age and almost everything to do with how you're drinking water every single day? That idea might sound surprising, especially when we've all been told for years that the solution is simple: just drink more water. But here's the reality most people never hear. Plain water on its own does not hydrate your skin the way you think it does. In fact, in certain situations, it can actually dilute the very minerals your body depends on to build collagen, maintain elasticity, and keep your skin firm and resilient. It sounds counterintuitive, but once you understand what's really happening inside your body, it starts to make perfect sense. Hydration is not just about pouring water into your system. It's about how that water moves into your cells, how long it stays there, and whether your body has the necessary resources to use that water for repair and regeneration, especially when it comes to your skin. Think of your skin like a construction site. Water is essential, no doubt about it. But water alone is like sending workers to that site without giving them tools, materials, or instructions. Nothing meaningful gets built. Collagen production requires specific building blocks, amino acids, vitamin C, trace minerals, electrolytes, and it also depends on stable internal signals like proper insulin function. Without these elements in place, the water you drink simply passes through your body without contributing to repair. And this matters more than most people realize because collagen loss is not just about appearance. It reflects deeper processes happening inside your body. When collagen levels drop, it often signals chronic low-grade inflammation, insulin resistance, poor mineral balance, sluggish detoxification through the liver, and elevated stress hormones like cortisol that break tissue down faster than it can be rebuilt. That's why you can eat clean, drink plenty of water, and invest in expensive skincare products, yet still notice your skin losing firmness and wrinkles becoming more pronounced over time. In this video, we're going to break this down in a clear and practical way. You'll see why plain water alone is incomplete, what simple and natural additions can transform it into something far more effective, and how small adjustments in your hydration habits can significantly improve skin firmness, reduce wrinkle depth, support joint health, strengthen your gut lining, and even improve your overall metabolic function. This isn't about trends or beauty industry hype. It's about understanding how your body actually works at the physiological level. You'll learn how hydration really functions inside your cells, why electrolytes and collagen signaling matter more than the amount of water you drink, what you can add to your water to support collagen production, and even when to drink it to get the most benefit for skin repair. Once you understand how your body uses water, you stop guessing and start making decisions that work with your biology instead of against it. Now, let's look at what's actually happening inside your body when you drink plain water. Most people assume hydration is straightforward. You drink water, your cells absorb it, and your skin becomes more hydrated. But biologically, it doesn't work that way. Water doesn't automatically flow into your skin cells just because you consumed it. Instead, it moves based on electrochemical gradients. In simple terms, minerals, electrolytes, and specialized transport systems determine where that water goes and whether it stays there. To make this easier to understand, imagine your cells as tiny balloons sitting inside a pool of water. The pool represents your bloodstream, which is already full of fluid, but those balloons don't just fill up automatically. They need pressure and direction to expand, and that pressure comes from electrolytes like sodium, potassium, and magnesium. These minerals create the conditions that allow water to move into the cells and stay there. When you drink plain water without any minerals, you actually dilute the concentration of electrolytes in your bloodstream. Your body detects this dilution as a form of imbalance. Instead of directing that water into your skin cells for hydration and repair, your system prioritizes restoring balance. The kidneys step in and flush the excess water out. This is why so many people find themselves drinking water all day, making frequent trips to the bathroom, yet still experiencing dry skin, visible wrinkles, and even stiffness in their joints. This state is known as hypotonic hydration, which essentially means you're consuming water without enough supporting minerals to retain it effectively at the cellular level. Here's the key point that often gets overlooked. Hydrating your skin is not a cosmetic process, it's a metabolic one. Your skin cells need electrolytes to draw water inward, amino acids to build collagen, vitamin C to stabilize and strengthen collagen fibers, and balanced insulin levels to prevent that collagen from breaking down. Without these signals in place, water alone doesn't contribute to skin health in any meaningful way. In fact, studies have shown that to reduced skin elasticity and impaired collagen production, especially as people get older. So, the issue isn't just about drinking more water, it's about whether your body can actually use that water effectively. Now let's focus on collagen itself because this is where everything connects. Collagen is the most abundant protein in your body, but it's also one of the most resource-intensive to produce. Your body doesn't create collagen unless it feels supported, nourished, and stable at a hormonal level. If your stress hormone cortisol is elevated, if your insulin levels are fluctuating, or if your mineral levels are low, your body shifts into a survival mode. In that state, it prioritizes essential functions over things like skin repair. This is why cellular-level dehydration accelerates the appearance of wrinkles. And there's another important factor to consider. When insulin levels spike, often due to sugary drinks or processed foods, collagen fibers undergo a process called glycation. This happens when sugar molecules attach to collagen, making it stiff, fragile, and more likely to break down. No topical cream can reverse that kind of internal damage. So, the goal isn't simply to drink more water, the goal is to improve the signals your body receives. When you add the right components to your water, you transform it from a passive fluid into an active message that tells your body it's safe to hydrate, safe to repair, and safe to build collagen. This concept isn't new. Long before modern supplements existed, many cultures naturally added minerals, salts, or plant-based elements to their water. They didn't do it for flavor, they did it because it worked. In the next part, we're going to focus on the single most important thing you can add to your water first. It's simple, inexpensive, completely natural, and strongly supported by physiology. And once you start using it, you may notice improvements in hydration, skin firmness, and collagen signaling much faster than you expect. Now that you understand why plain water alone isn't enough, let's build on that foundation and turn hydration into something your body can actually use. The first and most important addition to your water is something simple, something your body already recognizes, and something without which nothing else works properly, and that is electrolytes, specifically natural minerals that allow water to enter your cells and stay there long enough to make a difference. Most people never think about this, but every time you drink water, your body makes a decision before anything else happens. It asks a very basic question: can I safely hold this fluid? And that decision is not controlled by thirst, it's controlled by minerals like sodium, potassium, and magnesium. Without them, water becomes something your body tries to get rid of rather than something it uses. To make this easier to visualize, imagine your cells as rooms with closed doors. Water is standing outside ready to come in. Electrolytes are the keys that unlock those doors. If the keys are missing, the door stays shut, and the water simply passes by without entering. This becomes especially important when we talk about your skin, because your skin is considered low priority compared to vital organs like your brain and heart. Your body will always hydrate those first. Your skin only receives proper hydration when the rest of the system is balanced and supplied with enough minerals. This is where modern habits start to work against us. Many people avoid salt entirely, drink filtered or bottled water that has had most of its natural minerals removed, lose minerals daily through stress, caffeine, workouts, and heat exposure, and at the same time follow diets that are low in potassium and magnesium. The end result is a widespread mineral deficiency that often shows up as what feels like dehydration, but the consequences don't stop at feeling thirsty. This imbalance shows up directly on your skin. You may notice that your skin starts to lose firmness, fine lines appear more defined, facial volume looks reduced, and the overall structure supported by collagen begins to weaken. What's important to understand here is that this isn't always aging in the traditional sense. In many cases, it's a reflection of electrolyte imbalance. Research consistently shows that adequate levels of sodium and potassium are essential for proper cellular hydration and for maintaining the stability of the extracellular matrix, the structural environment where collagen exists. Without that stability, collagen cannot function the way it should, no matter how much water you drink. Now, it's important to clarify something. When we talk about adding minerals, we are not referring to processed table salt or sugary sports drinks loaded with artificial ingredients. What your body needs are small, natural, physiologically appropriate amounts of minerals that it can recognize and use efficiently. The approach here is simple, and for many people, the results become noticeable within just a few days. Start with a morning mineral water routine. Take a large glass of room temperature water, add a small pinch of high-quality sea salt or mineral salt, and if you want, include a squeeze of fresh lemon. That's all it takes. This simple combination immediately improves how your body absorbs water, helps reduce stress-related water loss driven by cortisol, and sends a calming signal to your nervous system that supports overall balance. When you look specifically at the skin, each of these minerals plays a distinct role. Sodium helps draw water into the extracellular matrix, which gives your skin that firm and hydrated appearance. Potassium works at the cellular level, helping move water inside the cells themselves, which smooths out fine lines and improves texture. Magnesium supports the system more broadly by reducing inflammation and improving insulin sensitivity, which protects collagen from breaking down prematurely. When these minerals are present in the right balance, water becomes something much more powerful. It shifts from simple fluid intake to what can be described as structural hydration, meaning it actually contributes to the physical integrity of your tissues. This is why some people notice an interesting change when they begin adding minerals to their water. They often find themselves drinking less water overall, yet feeling more hydrated. That's because hydration is not about how much you drink. It's about how much your body can retain and use effectively. And there's another important layer to this. Electrolytes don't just help with hydration, they also play a role in reducing glycation, the same sugar-driven process that damages and stiffens collagen. When your mineral levels are adequate, your insulin signaling becomes more stable, and that stability helps reduce the formation of those damaging crosslinks that lead to wrinkles over time. At this point, you can start to see how everything connects. Hydration, mineral balance, insulin control, and collagen integrity are all part of the same system. When one is out of balance, the others are affected as well. And when you correct that balance, the improvements don't just show up in how your skin looks, but also in how your body feels and functions overall. This is why understanding the why behind these processes matters so much. It allows you to make small, consistent changes that work with your body instead of constantly trying to fix symptoms on the surface. In the next part, we're going to take this one step further. You'll learn about a specific compound you can add to your water that doesn't just support hydration, but actually signals your body to begin rebuilding collagen. This is where things start to shift from maintaining your skin to actively improving its structure, along with benefits that extend to your joints and gut health as well. Now, let's take this a step further because proper hydration alone still isn't enough to rebuild your skin. If you want firmer skin and fewer wrinkles, your body needs a clear signal that tells it it's time to repair and regenerate. And that signal doesn't come from creams, treatments, or even just eating more protein. It comes from very specific amino acids that your body uses to build collagen. To understand this, we need to look at what's actually happening inside your body. Collagen isn't a single substance. It's a structural protein made primarily from three key amino acids: glycine, proline, and hydroxyproline. Among these, glycine is often the limiting factor. In other words, it's the piece most people don't get enough of, even if their overall protein intake looks sufficient on paper. This happens because most modern diets rely heavily on muscle meats, which are high in methionine but relatively low in glycine. Collagen production, however, depends on balance. When that balance is missing, your body struggles to produce collagen efficiently. And a simple way to think about this is to imagine collagen like reinforced concrete. Protein provides the base material, like the concrete itself, but glycine acts like the steel reinforcement inside it. Without that internal support, the structure may look fine at first, but over time, it begins to crack and weaken. That's exactly what happens in your skin when collagen production is compromised. Here's where things start to shift. When you add collagen peptides to mineralized water, you're not just supplying raw materials, you're actually sending a signal to your body to begin repairing tissue. Research has shown that small targeted doses of collagen peptides can stimulate fibroblasts, the cells responsible for producing collagen, more effectively than large, general protein meals. The reason for this is that your body interprets collagen fragments differently. Instead of seeing them as just another source of calories, it recognizes them as indicators that tissue repair is needed. That distinction is critical because it changes how those nutrients are used once they enter your system. Timing also plays an important role here. When collagen peptides are consumed in the morning or between meals, especially alongside minerals, they are more likely to be directed towards skin, joints, and connective tissue rather than being burned for energy. This is why simply adding more protein to your diet doesn't always produce the same results. It's not just about what you consume, but when and how your body receives it. A simple and effective approach is what we can call a collagen-enhanced water routine. Start with a large glass of water, add a small pinch of mineral salt, and include around 10 g of collagen peptides. If possible, add a squeeze of fresh lemon or another source of vitamin C. This step is important because vitamin C acts almost like a stabilizing agent, helping collagen fibers form proper crosslinks so they become strong and functional. Without enough vitamin C, collagen production can slow down, even if your intake of amino acids is adequate. When you connect this back to wrinkles, the picture becomes much clearer. Wrinkles form when collagen production decreases, when existing collagen is damaged by factors like sugar and oxidative stress, and when the skin loses hydration at the structural level. This simple protocol addresses all three of those issues at once. This means that even if you're consuming the right nutrients, your body may not use them effectively if it doesn't feel stable. That's why this approach works best when it's paired with stable blood sugar, adequate food intake, and a calm nervous system. It's not about forcing results, it's about creating the conditions that allow your body to do what it's naturally designed to do. As you start to apply this, you may notice that improvements don't just show up in your skin. Many people report better joint comfort, improved digestion, and a general sense of better recovery. That's because collagen is not limited to the skin. It's a foundational component of connective tissue throughout the body. When you support its production, the benefits extend far beyond appearance. In the next part, we're going to look at something equally important and often completely ignored. The minerals improve hydration and retention, the collagen peptides activate repair pathways, and the vitamin C helps stabilize and strengthen newly formed collagen. Together, these steps create an internal environment where your skin can actually begin to rebuild rather than just maintain its current state. There's also something important that many people overlook. Collagen production doesn't happen equally throughout the day. It's strongly influenced by your overall physiological state. When your body is under stress, whether from undereating, excessive exercise, poor sleep, or constant mental strain, levels of cortisol rise. When cortisol is elevated, your body shifts resources away from repair processes, including collagen synthesis. Even if you're doing everything right, adding minerals, supporting collagen, and staying consistent, there is one major factor that can quietly undo all of your progress. It's something most people consume every day without realizing the impact it has on their skin and overall aging process. Now, we need to address something that quietly works against everything we've talked about so far because you can be adding minerals, using collagen peptides, including vitamin C, and still see little to no improvement if this one factor is out of control. That factor is unstable blood sugar. This is one of the most overlooked drivers of skin aging, and it operates in a way that most people never connect to wrinkles or collagen loss. Inside your body, collagen is not a fixed structure. It's constantly being broken down and rebuilt. The balance between those two processes determines how your skin looks and feels over time, and one of the fastest ways to shift that balance in the wrong direction is through repeated spikes in blood sugar. Here's what actually happens. When your blood glucose rises too high, excess sugar molecules begin attaching themselves to proteins in your body, including collagen. This process is known as glycation, and it leads to the formation of compounds called advanced glycation end products, often shortened to AGEs. To understand the effect, imagine collagen fibers as flexible, elastic bands that give your skin its smooth and firm appearance. When glycation occurs, those elastic bands become stiff and brittle, more like hardened plastic. They lose their ability to stretch and return to shape, and over time they break down more easily. This is how wrinkles deepen, even in people who appear to be well hydrated on the surface. One of the key insights here is that beverages are one of the biggest sources of hidden glycation. Many people assume they're making healthy choices by drinking fruit juices, honey-based drinks, flavored waters, or even certain electrolyte beverages that contain added sugars. But even small repeated increases in blood sugar from these drinks can gradually damage collagen. It's not about a single spike, it's about the cumulative effect over time. And when you connect this to insulin, the picture becomes even clearer. Frequent insulin spikes accelerate collagen breakdown, reduce the activity of fibroblasts, the cells responsible for producing new collagen, increase inflammation, and slow down the overall repair process. This is often why early signs of insulin resistance show up in the skin first, long before any formal diagnosis. Dryness, sagging, and fine lines can all be early indicators that something deeper is happening metabolically. So here's the key takeaway from this section. Hydration, mineral balance, and collagen support only work effectively when insulin levels remain stable. Without that stability, you're essentially trying to rebuild while something else is constantly breaking things down. The first step in fixing this is understanding what not to add to your water. This includes sugar in all forms, honey, agave, fruit juices, and even artificial sweeteners that can still trigger insulin responses in some people. Even when something is labeled as natural, it doesn't mean it's harmless when used frequently. The downstream effect on collagen remains the same. The second piece is timing. When you drink collagen-enhanced mineralized water on an empty stomach or between meals, insulin levels are typically lower. This allows the collagen peptides to act as signals for repair, rather than being used as a quick energy source. In this state, your body's more likely to direct those nutrients toward rebuilding tissue instead of burning them. The third piece involves adding small elements that help stabilize blood sugar naturally. Simple additions like a splash of apple cider vinegar, a very small amount of cinnamon, or fresh lemon juice can slow the absorption of glucose and improve insulin sensitivity.